the second question now, if you're one of those people who can delay Medicare enrollment, should you? I'm going to go over some good reasons to delay Medicare enrollment and some good reasons to not delay Medicare enrollment. All right, so the first one, this is the easy knockout question as to whether you should delay Medicare. If you have dependents like a spouse or children who count on your group health insurance, they really don't have a reasonable alternative for health insurance. They count on what you have through your work, then it's probably best to keep that employer plan, that group plan, and delay your Medicare enrollment until retirement or when you otherwise decide, hey, I just prefer Medicare now, let's jump to it. Another reason to delay it, if you don't need Medicare's benefits yet, you don't use many healthcare services, you don't go to the doctor much, you don't get sick much, then you may not need the lower deductibles, the expanded network, the extra perks of Medicare coverage, especially if you're going to pay extra for it versus your group plan. If your employer plan is more cost effective than Medicare, then that's pretty obvious. It's a good idea to delay your Medicare enrollment if you can. So this is just a simple cost benefit analysis. How much are you paying per month for your employer's plan? Compare that to what you would pay if you were to switch to Medicare. To give you an idea, the lowest price Medicare plan all in is about $170 a month, and the best is about $350 a month. That cost increases if you're a high earner, and that starts to ratchet up at the $90,000 a year in income level and up. So the cost benefit analysis gets thrown out of whack a little bit. The more you earn, the self-assessment is going to have a calculator for you so you can see what your estimated Medicare cost would be, so you can do that analysis. Good reasons to not delay Medicare enrollment. Pretty simple here. You should go straight to Medicare when you turn 65, even if you have the choice to delay it if you use a lot of healthcare and Medicare's benefits are a game changer for your well-being. If, for example, some Medicare arrangements with a supplement in particular allow you to see any doctor in the United States that accepts Medicare. So if there's someone on the opposite coast as you who's the best person to help you with whatever your ailment is, you can go see him. You don't have to go through an insurance company to get their permission or any pre-authorization, anything like that. So that's really nice for the type of person who would benefit from it. And this is the obvious one. Is Medicare more affordable than your group plan? If that's the case, then there's really no argument. Move to Medicare. It's better for you. And I like to tease a little bit, although it's true. Get into Medicare as soon as it's worth it to you. Get some of your tax dollars back, because you've been paying for Medicare your whole working life, whether you realize it or not. You've been paying a lot of money into it. So get those dollars back. A quick note on COBRA. So a lot of people that I help mention COBRA. They're either thinking about retiring and plan on going to COBRA, or they're already on COBRA and they want it because their employer is subsidizing it, or for whatever reason, they just think it's the way to go. It's a good train of thought, but it's wrong. And here's why. So COBRA plans take a backseat to Medicare once you are Medicare eligible. Basically, that means if you go to the hospital, right, and you rack up $100,000 in bills from the hospital, the COBRA plan is going to take a look at that bill from the hospital and say, okay, where are we supposed to pay? Where are we supposed to insure this person? Looks like they're Medicare eligible. That means Medicare should be paying before we do anything. And if there's no Medicare in place because you didn't sign up for it, guess who's taking the place of Medicare? It's you. So you're going to be paying out of pocket before the COBRA plan pays. Suffice to say, that's a situation that not a single person I can think of would want to be in. So long story short, you can keep COBRA coverage if you want. Just make sure you have Medicare in place. COBRA is not a proper replacement for Medicare. And frankly, once you're on Medicare, COBRA becomes, in most cases, unnecessary. It's just an added expense. So keep that in mind. If you have Cobra dental or vision coverage, that's a different story. You can keep that. And that's because Medicare doesn't involve itself with those things. But just know for medical insurance, prescription drugs, things like that, Cobra, Medicare, don't mix, get Medicare. What about Part A? This is another question that people ask me, especially if they've done a little bit of research before we've talked. So Part A, you might have heard, if you've got the option to delay Medicare, well, I'll go ahead and enroll in Part A because it's free. There's no harm in doing that, right? That's true. It's not going to interfere with your existing coverage. It's going to pay secondary to Medicare. So chances are it's never really going to kick in, but hey, might as well have it if you want it. One note that I need to warn everybody about, if you have a health savings account, an HSA, you need to stop contributing to it 6 months before you enroll in Part A or in any part of Medicare. You can still keep the account. You can still use the money in the account. You just can't put more money into it. And that's because of the tax advantage with HSAs. There's just a conflict there with Medicare eligibility. So keep that in mind. If you don't want to enroll in Part A at 65, if you can delay it, that's generally fine too. Just know it's your choice. The HSA thing is the only thing to really keep an eye out for. If you are the person who does delay, what happens when it's time to go into Medicare after you have delayed? So let's say you have decided you're going to retire or you're moving to part-time and you're going to lose the benefits from your employer, or you get laid off or anything unfortunate where you lose group health insurance. No matter which way you lose it, if you lose it, then the clock starts ticking on your enrollment window for Medicare. So if you remember the initial enrollment period with the green, yellow, red, that doesn't apply to you in this case. This timeline does. You have 8 months after the month that you lose group health insurance to enroll in Medicare. Now, there are very few cases where it makes sense to exercise those 8 months. I always encourage people, as soon as they know their group health insurance is ending, go ahead and enroll in Medicare before, so that when your group coverage ends, Medicare can pick right up and you have no gaps in coverage, if at all possible. All right, so that is your special enrollment period. Just keep in mind, you'll see that verbiage every now and again. That's what it's referring to. If you're someone who can delay, once you've delayed and you're ready to roll into Medicare, this is the timeline that starts.